So, good morning and welcome to Women Who Rock with Success Media. And of course, this is your host, Miss Diane Winbush, and we thank you for tuning in with us on today. We know this week is National Nurses Week. Okay. So we celebrate our
Yay.
nurses that have gone the extra mile. I don't know where they get the strength and energy from that can help them to excel through this trying time. This is a very, very trying time. And plus, they just announced on the news yesterday that they're predicting that COVID would be spreading like 100 million more people and by the end of 2022. So we're going to have to
Wow.
put an extra layer of congratulations to these nurses who um, have went a long, long ways, a long journey, farther than what where we have gone. So, to be able to help us to understand a little bit more about Nurses Week, this is the president of the National Practitioners, and she is none other than April Kapu, if I'm pronouncing that correctly. And she's
That's
from
close. Yep.
Vanderbilt in Nashville, Tennessee. And of course, the audience probably may not know because this is an international platform. So for those that are listening from Tennessee, we want to applaud her. She's from Tennessee.
Yay.
Yay! Tennessee Titans.
Go
So,
Titans.
yes, exactly. So good morning, April, and welcome to the broadcast today.
Well, thank you for having me. It's such a joy to be here. And I echo Happy Nurses Week to all nurses everywhere across the globe. Just amazing work that they have done for years and years and years, but just tremendously so over the last 2 years throughout the pandemic. So happy Nurses Week to all the nurses out there.
Absolutely. So we're gonna get started, and we want you to be able to share with the audience a little bit about you. What was your passion? What compelled you to be able to get into the nursing industry, and what was, I guess, your desire to be able to work with people in the hospitals, medical fields, doctor's office, whatever that you worked before you became even this role that you're in today.
Well, I actually grew up around healthcare. My mom, she worked in nursing homes, and she would
Mhm.
often take me along with her, and I would follow along. And as I got older and older, I started to help her. So I'd help calculate supplies, things like that. And I really grew to love being in the nursing home and working with the different people that resided there and just talking and getting to know them better. And oftentimes, as you know, in nursing homes, it can be lonely. And so that was one of the things I loved, is just being able to sit down with someone who hadn't had someone to talk to in a long time and just spend some time with them. As I moved on throughout my life,
Mhm.
I ultimately decided that nursing was what I wanted to go into. And I actually went into ICU nursing, so intensive care unit. And the reason, a lot of the same reasons, I enjoy speaking with families
Mhm.
and patients. This is a really tough time if they're in the ICU. A
Mhm.
lot of people don't even know what an ICU is like until they
Right.
go. And then
Mhm.
there's machines and tubes and wires, and it's kind of scary. And so I really, really wanted to help people feel empowered, educate, alleviate worry,
Mhm.
to really understand what was going on with their treatment, their therapies, what to look forward to, how they can help. And so that translated on as I went on to become an advanced practice nurse, as a nurse practitioner. And I worked as a nurse practitioner in the cardiovascular ICU in Nashville
Wow.
for several years. And then really was able to move into some leadership roles as we developed nurse practitioners 24/7 in all of our ICUs,
Mhm.
and then ultimately became the associate chief nursing officer for advanced practice, and helped to grow the program across the system. And then today, I have been very involved with our professional association, the American Association of Nurse Practitioners, throughout my career as a nurse practitioner. Lots of resources, support, education, networking, but also the fact that they have leadership pathways. And I
Mhm.
was able to run for an elected position as state representative of Tennessee. And I
Oh.
did that several years ago. And then then went ahead and ran for regional director and served on the board of directors for several years, and then
Okay.
ran as president. And so that's what I'm doing today.
Okay.
Um, Going around meeting lots and lots of amazing nurse practitioners across the country and speaking with a lot of students, a lot of NPs in practice,
Okay.
really better understanding their issues. So it's just I'm just so honored to be able to serve in such a
Mhm,
manner.
mhm. So basically, the small beginnings with just going with your mother out to work paid off into this big dividend today.
It did.
Wow. Wow, that is so awesome. So, how has that been rewarding for you? You know, a lot of times, I try to tell people that you have to love what you do. You know, a person can't just be a nurse just to say, well, we are short of nurses. You have to have some type of heart and compassion for people. So, how has this down through the years been rewarding for you?
Yeah, I think that's exactly right. You should find joy in what you do. And when you're going to work, it's to be something you're looking forward to. And
Mhm,
so that's I've always had that driving me. I love what I do. I love taking care of patients. I love the intellectual piece, figuring out what's going on with the patient, the diagnosis, the management, taking care of those patients, but also the interaction. You just have that connection with every single person that you meet. And these connections with people are what's so important. And that's what I've loved. That's the joy
mhm.
that I found as being a nurse.
Okay, okay, great, wonderful. So,
Mhm.
kind of define for us a little bit about a nurse practitioner. Before the show got started, but both of us we were kind of talking a little bit about this, and sometimes individuals will get it kind of confused as to how much authority that a nurse practitioner has versus an actual MD doctor, and
Mhm.
sometimes individuals may not know that a practitioner can perhaps have the basically the same authority as an MD. As I mentioned before to you before we went live, is that we have some practitioners here that have opened up their own practice, their own
Mhm.
medical practice. And so sometimes individuals will say, well, oh, he's not a real doctor. Oh, she's not a real doctor because she's a practitioner. But no, it may be a difference in the wording, I guess, but I think they still may have some sort of same authority when it
Right.
comes down to care, medical terms, and whatever it is that they can do. So, but since you're the expert, you help us to be able to understand a little bit better.
Yeah, absolutely. So it helps to understand a little bit of the history of how we've evolved as a profession. So back in the 1960s, there was a wonderful pioneer. She was a pediatric nurse, and her
Mhm.
name was Dr. Loretta Ford. Her name is Dr. Loretta Ford today. But Loretta Ford and a pediatrician, Henry Silver, they were in rural Colorado, and they were experiencing a public health crisis, seeing that there were lots of patients across the state that did not have, lots of people across the state that did not have access to health care,
Okay.
rural communities, tribal communities, lots and lots of different people did not have ready access to health care. And they thought, what if we nurses, registered nurses, go back for advanced education and training?
Mhm.
Can they help to meet this need? And so now we've evolved. We're 60 years or so later, and now we have national standards for education, accredited education, training, and national board certification for nurse practitioners who are nurses that now have advanced graduate education, and in
Oh,
many cases like mine, doctoral education,
okay.
where we can provide care, we can diagnose, we can prescribe pharmacologic and non-pharmacologic therapies. We can order labs, diagnostics, we can interpret those. And here's something that we do really well: we coordinate care.
Okay.
So you mentioned the nurse practitioners in your community. I can tell you, if you went to see one of them today, they would be busy coordinating care, making sure you had access to everything you needed. Do you have access to the medications? Do you have access to your healthcare appointments? Have you had all your screenings done? Are you really taking a look forward in terms of preventative, preventing disease prevention, but also how are we managing your health so that you're healthy on a regular basis and don't end up having to go to an ED, hopefully, or urgent care. But we try to care for you. We collaborate with all the different members of the healthcare team. That might be a social worker, that might be a dietitian,
Okay.
that might be a case manager, it might be a physician, it might be even a specialist, a surgical specialist, but we are constantly coordinating your care, making sure it's comprehensive. And oftentimes when you hear about what's the difference between a nurse practitioner and a medical doctor or a doctor of osteopathy, a physician, what's the difference? The training is different. One is
Okay.
very much advanced nursing education and training
Okay.
built on the philosophy of nursing, understanding that someone's social context in which they live, their environment, all of that is very important and plays into their healthcare.
Okay.
Whereas a physician is educated and trained very much on a medical model. We collaborate and work together all the time, but oftentimes, like patients that may be going to the clinic there, they might think that there's a physician in the back room somewhere. There is not. The nurse practitioner is managing those patients and
Okay.
coordinating their care, making sure they have access to all of their healthcare needs.
Okay. Wonderful.
Mhm.
So do we find because sometimes even in the ER room, as you stated before, sometimes we be looking, oh, the doctor is coming, but sometimes it will be the ER, or it will be the practitioner that's there, that's on call for that weekend or for that day or for that night or what have you. So are we seeing a little bit more practitioners growing in the ER industry?
Oh, yes. So nurse practitioners are growing in every setting. Of course, my background is in acute care, so I'm a critical care nurse practitioner, but there are nurses that go in advanced education and training as emergency department or emergency medicine nurse practitioners. There are nurse practitioners in the hospital and primary care and all settings in primary care, specialty care.
Mhm.
We actually, Diane, over the last just throughout the pandemic, before the pandemic, we were at 270,000 nurse practitioners across the United States. That was in 2019, into
Wow.
2019, going into 2020. Today, we're at 355,000,
There you go.
expected to grow at a rate of 45% every year.
Yes.
That's how much in demand we are. Actually, according to US News and World Report 2022, the
Mhm.
number one healthcare job out there, because we are really filling in and meeting those needs that are in healthcare that are so prevalent today and were only magnified throughout the pandemic.
Okay, and that was going to be the next question, April. Sometimes we hear less about those that care for others so much. And so, how important is it for the nation to recognize nurses? As you stated, the nurses just came to the billboards at top number one when the pandemic came, but they
Right.
are so important the rest of the 365 days of the year, or the rest of the
Mhm.
before the pandemic started or before it came. And some of the nurses there are worn out. I mean, we can talk on this interview for about 2 or 3 hours as to how the nurses, some of them went to PSTD or PTSD. It's
Right.
and they went to they went through a lot, and it seems like people just pushed them away, just like it was no concern. But it is a concern because these are the ones that are on the front line. They're caring for our loved ones. They are putting themselves in, because who's to know whether, well, if I put on a pair of gloves, I want to go home with my children. I want to go home with my husband. I want to go home with my wife tonight, or what have you. And sometimes I felt that they got kind of caught up in the trenches. I do. I really feel that they got caught up in the trenches, and before I make that opinion, I'm going to keep that opinion to myself. But just tell us how important it is to recognize nurses, not alone just practitioners, not just doctors or what have you, but the nurses and the practitioner. I think they work hand in hand. They have to get the orders from the practitioner. They have to take the
Mhm.
orders from the and see what the next step is. How important is it for us, just not just for Nurses Week, for every day of the week?
Every day of the year. And this year, Nurses Week has so much more meaning. It is
Mm,
so much
it
more
does.
meaningful to us because we have taken note of what nurses do. And everyone that is listening has probably come into contact with a nurse in the
Mm,
clinic, in the hospital. They have experiences with nurses and they know what they do.
mm,
Well, at the beginning of the pandemic, nurses were stepping up over and over and over again because this pandemic was happening. This was their space. They
mhm,
were running to the fire. They were not running away. They were running to it. And
mhm.
they were putting up tents and community centers out to do testing in the communities. They were knocking on doors. They were making sure everybody had access to these vital services that we were learning so much about throughout COVID. They were putting in makeshift emergency rooms. They were staffing the ICUs 24/7. They were working extra and overtime for their coworkers who were out because of COVID or family members that were out because of COVID. They were caring for
Right.
patients that had a very new and different virus that was devastating. And oftentimes they were the one person there as someone was going through the process of death and dying because their family members couldn't be there, or they were coordinating this via Zoom. And so nurses are the emotional
Right.
toll, not to mention the physical toll of all of the staffing shortages and everything that they were experiencing throughout the pandemic. But the emotional toll and the mental toll has been exhausting. And
Right.
the American Nurses Foundation just did a huge study and looking at nurses today, all nurses, and 51% had said they were exhausted and
Mm,
overwhelmed.
yeah.
And 80%, I think it was 81% of those, the ones that were less than 34
Mhm,
years old, were
mhm.
saying they were exhausted and overwhelmed.
Wow.
This is our new generation of
Right.
nurses, right? That's
Right.
that's the next generation of nurses already showing signs and symptoms of burnout.
Right, right, absolutely. Which is going to come to my next question, April. We saw a lot of nurses and nurse directors to resign at the top level,
Yeah.
and you mentioned a key word, and that was emotion, and that's just something that we're going to try to assume. We're not, we can't say the reason why they resign, but do you feel that that may have played a factor, after all of this pressure, especially, we had the I think it was the one that was over the health in Tennessee, and I know Shelby County went through some changes in Memphis, Tennessee as well, and in some other states as well, where the head nurses, they just no, we're not gonna go, we're not gonna take this. They just resigned when the pandemic hit. So do you feel that that was like an emotional factor that played a part in their decision due to the fact that they perhaps maybe felt that they was unappreciated? I'm doing all that I can. I'm doing the best that I know how to. And now here you come, you're criticizing me and I'm trying to do the best. I don't know how, this is something that I'm not accustomed to. I'm not used to handling something like this. And so I just felt that even in the situation in Shelby County, I just don't feel that they gave them enough chance,
Yeah.
opportunity. So, do you feel that emotion may have played a part in some of their decision to just resign, or for even the state to resign them? I think in some instances, the state stood up, and people be looking for answers, but I think we need to calm down a little bit. Just like you
Mm-hmm.
stated, people do studies. Just calm
Mm-hmm.
down. Don't get excited. Just calm down, because that can hurt a person emotionally if you feel that they're not doing an effective job and they know that they have been doing it for years and they're trying to do
Mm-hmm.
the best thing that they know how to do.
You said that so well. There are, I mean, if you can imagine being at the point where you've worked day after day, night after night, you've come in every time they've called, you're physically exhausted because you're not only managing patients at work and everything that's happening at work, you also have a lot going on at home, right? All the usual stressors that are
That's right.
happening with
That's
life in a
right.
pandemic.
That's
And
right.
so that just the physical toll, but then the mental, everything we're seeing in the news,
Mhm.
and then the emotional piece. And so if you are so exhausted and overwhelmed, that is definitely a point where someone might say, I'm done. I'm walking away. And
Mhm.
so what structures do we have in place? And I think that's one of the things that's been highlighted.
Mhm.
Do we have structures in place to support nurses?
That's right.
Do we have a healthy environment where someone that is, maybe you've had 2 patients die that day, do you have someone you can talk to because you're grieving as well? Or are you just being expected to just keep moving on? You have to have mental health support too. And do we have policies in place that protect nurses from working too many days or nights in a row?
Hmm.
Do we have cultures where we support and we know they're doing their best and they're trying their best, and we need to recognize that and
Right,
honor that, and
right,
honor all of the innovation and creativity and the hard work,
right,
and know that we've all done the best we could do
right,
throughout a pandemic,
right,
and have been right there on the front lines the whole time.
right, right.
So I think you said
Absolutely.
that really
Right,
well.
right.
We are seeing people leave,
Hmm.
and that's unfortunate.
Right.
So when you mentioned study, I led a study, a
Okay.
task force of nurse practitioners.
Hmm.
And this was just before the pandemic, where we were assessing the degree of burnout of nurse practitioners. And so we had several tools we used, and we were able to assess whether or not you were identifying through your answers as being
Hmm.
currently burned out,
Hmm.
or not burned out, or having been formally burned out.
Right.
And so we learned a lot from the study. We learned a lot about the importance of being social inclusion. We learned about healthy work environments. We learned that we need more funding nationally for mental health services and to destigmatize access and getting mental health services. But I think we learned something that was just so compelling from the formerly burned out. These were nurse practitioners that identified with, they were burned out at one point, but they were no longer experiencing signs and symptoms of burnout.
Right.
And the theme that came from that population was to make a change. And the change was all the whole spectrum, all over the map. It could be they joined a social group, they did something differently in their personal life. Many did something differently in their professional life. Some just said, you know what, I'm gonna work clinically this many days a week, and then I'm going to educate. So they started to do a little something different. They moved to work in a different clinic or a different unit. But like you said, some unfortunately completely walked away from nursing
Mhm.
because they were just so burned out. But make a change. And so I think what I learned from that is,
Okay.
how do we have an environment where you can make changes, where you can say, no, I can't be in this ICU all the time. I need to do something a little bit different. Do
Right.
we have that opportunity for professional growth, for
Mhm.
career advancement, to shift a little bit so we can get back our mental health, our emotional health, our physical health, and continue to enjoy our career as being a nurse?
Mhm. Absolutely. I don't even think that the world can even grasp as to what some of the things that you all had to encounter and still are encountering. I mean, it's not over with yet. You still have hospitals that are enrolling individuals due to the COVID, 19 and the virus and what have you. And so this is going to be my next comment. I guess I want to make because we were so critical, and I don't know what nursing home it was or even the nurse, but I think the world was too critical about the nursing home that went in there and packed the bodies in a room. Look, people, we talking about burnout. People, when they are burnt out, and then the first thing they're thinking about, well, am I next? And then the next thing they're thinking about, my family. They're thinking about the children. We have to learn how to take the negativity off of the thing. And the gentleman that was the whistleblower, I mean, that was his right and that was his opinion and what have you. But I felt that I would have looked at it in a different way, even though whatever that nursing home may have done, it may didn't look right, but the people did not know what to do. Their backs were against the wall. They did not know what to
Mhm.
do in that situation. And so when I saw the news, I think it was last year, maybe 2020, It may have been 2020. I said, no, we don't need to be judging that nursing home, the hospitals. We don't need to judge nobody that's affiliated in that situation because we don't know what they were going through at that time. People were in a panic.
Right.
Some people are still in a panic. Some people are on the beach. They're not in a panic, but you still have individuals, hospitals that are in the panic because the nurses are on the edge. When is this going to come back up? We keep seeing a rise and a fall. And that's going to be the next question that I'm going to ask you as to the declining and inclining of the COVID-19 and where we are today as on your perspective as far as Vanderbilt University.
Well, COVID continues to be, I mean, it's out there, it's continuing to create variants. It continues to be very contagious and pervasive.
Okay.
And I think that we're watching both the numbers of positive tests, which is a little bit more difficult to watch these days because tests are so easy, so much more easily accessible than they
Right.
were. And
Right.
so people might be taking tests at home
Mhm.
and isolating on their own. You might not be able to publicly report that, right? They may not publicly report that. So it's a little underreported, the positive tests. But what we can monitor now is certainly the numbers of hospitalizations of patients coming in due to a primary diagnosis of COVID. Now,
Okay.
many patients that come in, they've had an accident, maybe a car accident, and they come in and it's a finding that they also have COVID. And so understanding those that are hospitalized for primary diagnosis of COVID, as well as those that come in and it's an incidental finding, those are the types of data we're following today. And then certainly continuing to follow the death rate related to COVID-19. So that would be the instigating factor would be COVID-19. So we're following those rates. We continue to see that COVID is
Okay.
very pervasive, but we also are seeing that the public is much more knowledgeable. So if they are finding that they have signs and symptoms that's very, it's very obvious now what signs and symptoms of COVID are, they're testing. Or if they've been exposed with a group that someone had COVID, they're testing. And if they test, then they are very knowledgeable. They're staying kind of away from other
Mhm.
people. All of the things that we learned and very, kind of drilled into our minds as we went throughout the pandemic, people are much more knowledgeable. I've seen if they will wear masks if they feel it appropriate to wear masks. And so you see people stepping up and saying, okay, I know the basics, the hand hygiene, I know the respiratory care, I know about the mask and being in public and testing and those types of things. But we
Right.
also see many people getting the vaccination, which was really important to me. I could not wait to get vaccinated. And
Mhm.
I just, because I'm over 50,
Okay.
several years over 50,
So am
I
I.
went ahead and got my booster
Mhm.
last week. So I have had 4 vaccinations, the first 2 and then 2 boosters, just because I know how important it is to have some immunity against these variants that are coming out. So we have tools now, tools in our
Right.
toolbox to deal with COVID-19 because it's not going away. It's now a virus that's out there, it mutates, it changes. But
Mhm.
what are those tools that we have? And now we have more and more therapies. What are all these tools that we have so that we can really best combat the virus? So we're in a very different phase now than we were 2 years ago when it was
Mhm.
new and we didn't have therapies, and we didn't have enough PPE, and we didn't have
Right.
all those things. Now the public's much more knowledgeable. We have in the antiviral therapy, we have different therapies that we can put into place, and
Mhm.
we have the biggest tool of all, and that's vaccination.
Okay. So has telehealth increased on your perspective of where you are? I know it's increasing in other additional states. We just had a physician on about a month ago in Chicago in regards to the telehealth and what have you, and how it is impacting in the Chicago, Illinois area. So what about we're going to talk about Tennessee? Is that an impactment that it is? growing for telehealth in the state of Tennessee in regards to, that we got the COVID. I don't want to come in and I don't want to sit on the same seat that somebody else. I mean, everybody got their own different opinions and what have you. So in some other states, this trend is growing. So we want to talk
Mhm.
about how can be growing in the state of Tennessee and Vanderbilt. How have you seen a change as to versus the people coming in doing traditional healthcare versus healthcare in with the telehealth?
Yes. So before the pandemic, we telehealth was there. It was available. Some companies, some practitioners took great advantage of it. They were very good at telehealth, but the pandemic almost pushed us into a space that many of us weren't as familiar with from a technology standpoint.
Okay.
So it pushed practitioners to embrace the technology and to be, okay, how do I have a conversation with a patient via telehealth? How do I reframe my assessment skills to ask all the right questions so I can appropriately care for someone virtually? And then patients who may not have been as familiar, they may not have had access to a computer. Many patients don't have smartphones, so they only have landlines. So it was patients better understanding how, okay, how do I access telehealth myself? So there was a lot of education early on. And I
Okay.
remember having phone conversations with a family and kind of talking them through setting up the computer and
Mhm.
what to push so that we could connect via telehealth. Now, both patients and providers are much more comfortable in that
Mhm.
space. And so
Mhm.
now we know, wow, we can reach so many more people.
Right.
I may not need you to come in for a regular check of your blood pressure today because I'm going to talk to you. You're going to show me your record. We're going to talk about what's going on and we're going to make sure things are okay because
Okay.
we're having our conversation now. But maybe the next appointment you do need to come in so we can do a complete physical exam and
Mhm.
check. So now we're seeing what appointments can be done via telehealth and what appointments need to be done in person. And now we can access more people. People can
Okay.
more readily access care. You
Okay.
see, the new generation today, they want to be able to text someone or call someone or push, the button on their computer and immediately be able to contact a healthcare provider. And
Wow.
that's possible now. And so we've seen telehealth go through the roof
Wow.
and not just at our hospital, but across Tennessee, across the
Mhm.
nation, telehealth is being used as a viable tool to increase access to care.
Wow. Wow. That is so amazing. And I think it's just, in certain jurisdictions, they may not have it set up and what have you. Baptist is my healthcare in some areas is not set up yet, but hopefully they will get to this. So, with the last question, April, we would like for you to be able to encourage the nurses. What would you say to a nurse that has pulled up to their job for the day, and they was like, "No, I just don't think that I'm going to do this because I don't know what's going to happen. I don't want to be bothered today. I'm just stressed out." What would you say to a nurse? We're here to encourage them because they're going through so much. Even though we have nurses that are enrolling in universities too now, but we also have a lot of nurses that have left the industry as well. So this is an encouragement, impactment, or an empowerment moment that you could be able to share with all the nurses all over the world to encourage them as to keep the fire burning.
I think the first thing I would do is I would reach out and give that nurse a hug, a
Mm,
hug, a hug, a hug, just to say, thank you.
mhm.
Thank you. You are valued.
Right.
Every moment you have spent serving others has been valued, and you need to take a moment for yourself.
Okay.
If you want to be able to enjoy what you do, continue to find joy and caring for others, care for yourself.
Mhm.
Take time for yourself. So this year, Nurses Week, I hope that nurses everywhere will see how important self-care is and to take some time away, go outside, see, go for a walk,
Mhm.
might be if they can take a vacation, spend time with people you love, your family, your friends. but take time to put work aside and care for yourself.
Mhm.
Because to be able to bring your very best self to your patients, you have to take care of yourself. And so
Absolutely.
I think that would be the advice, the guidance I would give. It's okay. Don't feel guilty. You have permission. You are empowered to care for yourself,
Ab-
because if anybody deserves it, you absolutely deserve this.
Absolutely. That is so sweet.
Yeah.
That's wonderful for the
Yeah.
nurses. So you all heard that, right? Okay. So do not take the ignition, the key, and take it out of the ignition and go back home. You stay on the job so you can be able to help and care for others who need it so far more through your help and assistance. So, April, we thank you so much for being with us, but we don't want you to leave until you be able to share with the audience how they can follow you, any social media sites that you would like for the audience to connect with you with, any publications, books that you have published, you can share that, where to find it on Amazon or what have you. And also you can be able to share your website links of how the audience can kind of go deeper into your research and your study of who you are and how you continue to impact the world through your medical field.
Yes, absolutely. So I would say first and foremost, Twitter and Instagram, it's at President AANP. I am tweeting every day, multiple times a day as I read articles. I'm high-fiving NPs that have done great things. I'm notifying of different events coming up. So that's one. And then LinkedIn, you can easily find me on LinkedIn, April Kapu. A lot of my publications are there. You can Google. I've written several book chapters, many hundreds and hundreds of articles, a lot of it about mental health and leadership, and many other topics. So you can Google, you can easily find me there, but I am on Twitter, Instagram, and LinkedIn, and certainly aanp.org, aanp.org. Lots and lots of information, a lot of my articles, as well as many other NPs, lots of resources and supports for nurses and for nurse practitioners everywhere.
Okay, awesome. Thank you so much, April. We have enjoyed you today. I wanted to kind of continue the show on today. I said, well, I know she probably has a busy day to unpack, and so, but however, we thank you and hope to have you on the show again as a guest, so we can follow up with, as things continue to progress and some things continue to digress. But however, we thank you for taking the opportunity out of your schedule to be our guest on today. And so, listeners, of course, you can meet us here once again on our radio station, as well as our live streaming on Women Who Rock with Success Media on Thursdays, as well at 9 o'clock a.m. and back for Women Who Rock Investigates at 10 o'clock a.m. Central Standard Time. So everyone have a wonderful day. Thank you, April.
Thank you. Happy Nurses Week.